Welcome, everyone, to Women Talking Wednesday, exploring holistic health options for women. Let's start with perimenopause. Can you talk to us about what some of your patients present with?
Sure. In perimenopause, everyone experiences it slightly differently. I think the very common symptoms are hot flashes, difficulty losing weight, hair loss is a big one, definitely decrease in libido, um, and overall just feeling more fatigued. And also changes to their period, which I think is something that people don't expect. We think of perimenopause or menopause rather as like you just stopping your period, but in those few years leading up to eventual menopause, oftentimes people actually experience heavier periods. And just like these hormonal symptoms that they never experienced before. So it leaves people very confused and a little bit lost. So, in terms of, naturopathic strategies, again, it's really just looking at things holistically. So, might do some testing, for example. So, testing estrogen may or may not be helpful. Like, to be honest, if we're gonna test estrogen in someone who's perimenopausal or menopausal, you're gonna see that it's low. But still, some people like to see that. They just like to have a baseline. So, if we're interested, I'll still do it. Maybe we'll check depending on what you're going through. Maybe we'll have to see what your cortisol looks like or your insulin looks like, um your testosterone even. All of these different hormones will give us the information that we might need to start tackling the problem. In the meantime, like we'll talk about exercise and diet and all those things. And I'm not going to go into too much detail about those today, but overall, for anything that we're talking about, diet and lifestyle are foundational, um, to helping with hormonal problems even.